Welcome everyone to ACC Michigan chapter, Healthcare Advocacy. We started to think about this concept of introducing the healthcare advocacy part. As we all know that advocacy is a very powerful tool for change. And as physicians and caretakers and cardiovascular team members, it's imperative that we get involved to address the things that are very important to all of us, which is access, quality, and value of patient care, and also on top of it, clinician well-being. This is something that we have thought through carefully with our chapter executive helping us to coordinate so that we are prepared to be ready for the advocacy meeting, which is actually going to be happening in Washington, D.C. As you know, cardiovascular disease is a #1 cause of death and leading driver of healthcare costs. And to have a solution, we need to know the problem at hand. And to address those, we need to be prepared as part of the advocacy efforts. So I have today, my name is Sunil Rao. I'm one of the practicing cardiologists at Ascension Genesis in Grand Blanc. And I have Dr. Peter Fatal, who is a practicing cardiologist at my Michigan in Saginaw. He's been a great advocate for patients and advocacy chairs for many years for ACC Michigan, which is where I learned a lot of aspects of advocacy from, which has energized me and have continued to do this every year. A little change that happens every year, but a big impact at the grassroots level. I'm going to introduce him, and then we have ACC Advocacy Team, a wonderful team, which is placed at Washington, D.C. I have Meg Novak and Frank Ryan. If you can please wave your hand right there so they know you. They actually coordinate this every year and make sure that we have access to all the resources and get to meet our state legislatures in Washington, D.C. as we do our rounds. So I'm going to go ahead and start introductions, and I'm going to introduce Dr. Peter Fatal, who's going to give a brief introduction and history of Michigan and the chapter advocacy. Dr. Fatal.
Thank you, Sunil. Thank you very much. Welcome, everybody. This is something that is very important, but often overlooked or missed. And the first thing to remember beyond anything else is that you guys are the ones that know how to manage the disease process that is responsible for the greatest morbidity and mortality of any disease process. You understand how to take care of a patient. You derive your joy and pleasure from managing them in whatever fashion you do, sitting across from them, managing their heart failure, taking them to the cath lab for a STEMI, opening up their blood vessels, doing these new elaborate, fantastic structural heart programs like clipping, et cetera. So the advancements in therapeutics, both pharmacologic therapeutics as well as interventional therapeutics, have just been dramatically wonderful. And we are our advocates for our patient when it comes to making those decisions. Unfortunately, we have to do that in the light of the fact that a lot of this stuff, as we do a better and better job, correlates with increased cost. And this is something that is a problem within our country. So the healthcare expenditures have gone up. Our patients get older, they require more care. The type of care that we deliver is often more and more expensive. And the amount of people required to deliver that care also gets greater and greater. So in the context of what we do professionally, there's this overlay of stuff that historically I never felt like I wanted to pay any attention to, and probably most don't, but we are increasingly forced to pay attention to that. Our very ability to survive in this world is dependent upon people looking at how we deliver care and how do we remunerate people for delivering that care. And as a result, there's a constant battle or understanding. One more important thing to remember, and this is something that I'll keep coming back to it, is that You know more than anybody else how to manage these things. The frustrations that arise in our daily practice comes from the hurdles that are put in front of us to try to deal with things that don't make sense to us sometimes. Why can we not do this? Why do we get shut out? Why is there difficulty trying to do the care that we know so well? It's important to understand that we are dependent upon a lot of legislative issues that define some of the ability for us to be able to provide that care. So Medicare, which is for all of us, our predominant payer, is under the control and oversee of the government. And so they are constantly looking at our expenditures. And a lot of the legislation that arises from that revolves around that. Now, it's important to remember a couple of things. You know more than any legislator when it comes to how to do things from a cardiovascular disease process standpoint. The other thing is that if you look right now in Congress, there are just over 17,000 bills that are proposed in Congress right now. And if you look historically, probably only 6 or 7% of those bills will actually become law as they move forward. And the process of moving that from a bill to a law is long and slow and laborious. And you also have to realize that for every one of those bills, there is somebody or a group of somebodies that are very passionate about it and think that that's the most important bill in the world. So when we do things to try to make our voices heard, we're not the only voice that's out there. Now, I will argue that we are probably the most important voice because we are trying to take care of the disease process that's resulting in the most damage to ourselves, our neighbors, our friends, and families. So our voices should be heard. The ability for us to be heard comes from advocacy. It's very easy for all of us in the office or in the cath lab to kind of complain and bitch about, oh my God, this is so difficult to deliver care. This prior authorization is impossible. Why are they reducing our income? Why are they cutting our reimbursements? And those are all appropriate things, but the question is, how do you act upon that? The way you act upon that is through advocacy. It was an eye-opening thing the first time I went to DC when you realized how big and cumbersome it is, but you also realize that the ability to access and provide information for those legislators is critically important. One of our former people that used to go to this used to say, if you're not at the table, you're on the menu, which means your voice has to be heard. You have to be able to say why this is important. We have the greatest professional organization in the world. And I say that from a variety of levels. This provided us with information about how to manage patients, how to take care of them, how our training is done. But in the process of doing that, we also have accumulated a whole bunch of information about outcomes, about how to do things right, and that if we do it right, we can do it with less expense. So the voice that we have from all of you is that we know how to do this. Let us try to do it. I won't get into legislations. I will tell you that over the past many years, there have been some successes that probably most people aren't completely aware of. The biggest one was the SGR, Sustainable Growth Reduction Act, which was now, I don't know, Meg, probably 7 or 8 years ago, or I don't know, which was a very draconian effort of the government to reduce expenses by cutting everything across the board, which meant that the Medicare reimbursement to physicians would go down with a dramatic cut. We went to Capitol Hill, we talked to people, we said why that's wrong, how that's a problem, and eventually that got overturned. Now it got overturned and replaced with something else, and now we are looking at what was better than the previous, but now still leaves room for improvement. I encourage everybody to try to get involved more in advocacy. That is the way that our voices are heard. The more people that are involved in advocacy, the louder our voice is. When you go down to Capitol Hill, you will see swarms of people that are wandering the halls with their own message. Remember all those bills I told you about? There are people that will look at that and say, I think I'm important and I want them to know why. Again, I encourage all of you to try to attend the conference and be a part of it. Our voices, when we go to the legislators and say, this is why this is a problem, this is what's happening in the face of reduced physician, the ability to access healthcare, the expense that it incurs upon healthcare providers is enormous, and we feel it, whether we recognize it dramatically or not, whether you are actively involved in the prior authorization process or not. Our ability to make headway, which we have done, is dependent upon your involvement. So my little introduction is that remember, the most important thing is you are responsible for the care of these patients. You know more than anybody about them. That message needs to be sent to the legislators, and there needs to be some sort of an understanding about how the legislation that affects that could adversely affect our ability to deliver the care to their constituents, to themselves, to us, to our neighbors and our friends and families. We are not, nor should we ever be angry. We should be supportive, and we should provide a solution. We should say, we have the data, we have the outcomes, we understand how to manage this. Let us be a part of the healing process. And it has happened. So again, my pitch to all of you, I don't know how many of you are out there, but please consider and try hard to come down to the legislative conference. It is very different than anything you have ever done during your professional career. It is a whole different area, but it is probably one of the more important things moving forward in terms of trying to guide and help legislation.
Thank you so much, Peter. Before I bring in the advocacy team, we have a couple more minutes based on the agenda. There are a couple of questions that I wanted to ask you, and the reason I do this is I want you to address this to our FITs and early career physicians. The first question I had was, why is the knowledge on healthcare advocacy a key to make a change? And how do fellows get involved and early career should be more involved? If you can harp on that.
Yeah, so those are both fantastic things. I will kind of segue and kind of push off even more on that, which is if you're going to try to identify the important people to get involved in this, it's probably not, ancient guys like me, but the young guys that are just entering the field now. They're looking at a career that hopefully will span 30 years plus, and they're going to have to be faced with a lot of issues when it comes to these reimbursement stuff. And it sounds dirty. It sounds like I don't want to be worried about that, but you will not be able to provide care in the means by which you think you would like to if you're not involved with some of that. If you look at Medicare as sort of the classic example, reducing Medicare is crazy because in any other world, there's not a reduction in ability to pay for things. There is an increase because costs go up, regardless of what you're looking at. So the continued decline in Medicare reimbursements, the continued cutting back of the ability to provide services, access to patients, that not only affects bottom lines for us, hospitals, everybody, which you could argue is less important, and I would not disagree, but all of that translates into poorer patient outcomes, poorer access to care for patients. And so that's kind of what we are involved in. So particularly the FITs, I kind of hope and wish that this training would be a part of fellowship training all along because it's so important. If you want to get involved, there's many ways to do that. You can directly contact these people and say, I want to be involved. Try to get free to come down to the legislative conference. It is wonderful when we go to that meeting and we have a large group of people that span the entire spectrum of our healthcare providers. So old guys like me that have been practice, young people that are just starting, and we have the unique, maybe slightly less than in the past, but the unique opportunity that we have a broad base of people that take care of it. We have fellows, we have APPs, we have pharmacists, we have even administrators that come along because the package is done through an entire community of care, not just through us. And in fact, we recognized that long ago, that our ability to be efficient in healthcare delivery is to do it together as a team. And that is the voice that we present to the legislators, which is, I think, very unique and very powerful. We are representing a whole spectrum of care, not just us. We are not going in there bitching about how this impacts my practice or my life or my income. We are saying, this is a problem for healthcare delivery. So all of the FITs, early career people, please jump in and get involved. We need those voices. We need that participation. We need them to hear the difficulties that you all have when you're trying to practice in this world.
Thanks so much, Peter. And I think this is a great introduction and at least gives an idea to early career physicians and FITs as to how to get participation in this unique cause where we can bring back to the grassroots and energize the local legislators and, of course, your colleagues and your cardiovascular team, which is a team-based approach. I'm going to ask the ACC advocacy team, and we had particular 3 points that we wanted to address, especially if you can give us an overview. The most important thing is the role of ACC in advocacy. The next thing is the key issues which are facing the ACC at a national level, because we talked about the local level, and then identify what are the top issues that we're going to address at this coming conference. But then we're going to give you about 20 minutes to do that, depending on whether Meg or Frank, whoever wants to take those questions. And then obviously walk us through for the coming conference to what the agenda is and what to look forward to. So Meg or Frank, thank you.
Frank, I think you might be on mute, but Frank's going to kick us off and then I'll follow up.
Hi, I'm gonna kick off just quickly and talk about a couple of state issues that sort of they kind of cross over into everything else, because that's what our team does. Is we monitor state issues, and we work with a broad, just like the people that Meg works with. We work with a broad scope of interests, medical societies, American Heart, hospital associations, sometimes not with them, but sometimes, a lot of times we are with them. I would say more often than not, we are. So I'm going to just real quickly sort of go over what's going on there. Now, I know that you've all heard of, you saw what happened with the football player, Lamar Hamlin, who's last year when he had sudden cardiac arrest on TV. So that basically had a huge influence around the country, and the NFL started a program to get legislation to get AEDs and trained personnel at sports events, and just to have not just sports events, but just anywhere where there's a lot of students. And I don't have the numbers exact numbers in front of me, but we've been very successful in just improving the environment at a lot of these schools. And I think there was so much enthusiasm when this started out. I think people thought, oh, they'll be, in a year from now, everyone will have what they need, but it's going to take a long time. But we're very proud of the way ACC and a lot of our partners have stepped up. And so we have a lot of momentum, and we've used that to, for lobby days around the country. We did a great thing in Michigan. We passed some really good legislation there, which has been really a model for other states. And so it's, we really feel we're on the way. But there's some other issues that I'll just sort of list instead of diving into them. But one of the big issues that's still with us since COVID, for example, has been clinician wellness, and specifically when just protecting healthcare workers and patients from violence. There was a lot of that unfortunately happened during COVID, and the statistics, it's getting better. Obviously, clinician wellness extends to other areas of policy, but just the immediate protection of healthcare workers is critical. And we've worked really closely with medical societies and EMTs and just a broad group of constituencies to improve the systems that are in place. Because sometimes, when something happens at a hospital, it requires really the community to step in immediately, depending on what the situation is. And so we're learning a lot about these and what it takes, financially and policy wise to get these through. That's always been the case with medical malpractice issues and now we've just seen with non-compete legislation. I'll give everyone a quick update on that. I know it's something you've probably been following through the ACC. The Federal Trade Commission or the court overruled the Federal Trade Commission the other day and said that they didn't have the authority to say that that to ban non-competes, essentially. Now, as we said, early on, this is going to be litigation on this is going to take a really long time. That's step one. I mean, the FTC is sure to appeal this, and we'll see what the next step is. So strap in, and we'll, but we're going to, every step of the way, we're going to do comments. We're going to weigh in. But we've had some success in the states with in Maryland, we were able to pass legislation, came close in New York, and we're gearing up again. So, one of the best things that just came out of it was there's just a lot of momentum now. People are paying much more attention to it, and legislators they're much better listeners all of a sudden. A lot of them want to do it, and a lot of them just need to be educated on it. And then a lot of it's just a partnership with legislators thinking, what's the best way to do this for a particular state, especially now that the FTC doesn't have a just permission to carte blanche put in whatever policy they want. So now, before I finish up real quick, I just want to say that, so, each state, each chapter has different challenges, depending on, what the legislature wants, depending on, what the healthcare market's like. But, some of these issues, that the main ones that we go through are pretty much the same. There's probably, four, at least for state issues, there's 4 or 5 that are pretty much the same in every state. And each year, I think we're doing better, where we get more momentum, and we're educating more people, and we're building stronger coalitions. So as much as you can work with your colleagues in the medical society and AHA and other areas, that really helps us push the ball down the field. And I think that we're one of the more respected groups, one of the more respected physician groups. But when they see us in a leadership role, when they see you all talking so conversantly about some of these issues, I think it makes a huge difference for them. It gives them a level of comfort that they don't normally have. So we as staff very much appreciate that. So I'm going to turn it over to Meg. If there's any questions I can answer real quick, I'm happy to do that, or at the end. And like I said, there's going to be a session on the state advocacy, but the Ledge Conference is basically a federal, because you're coming to Washington, and but those issues, there's so much overlap. It's just very interesting. So, and we really appreciate your involvement. So, thank you.
Thanks, Frank. So there's certainly a lot of overlap and issues at the state level and the federal level. And we're also going to use some of the time at legislative conference, which I'll talk about in a little bit, to really hone in on the fact that advocacy is really 365 days a year. It's not just coming to DC for legislative conference. We certainly want to arm you with the tools to be able to take this back home, advocate, whether it's in district with your federal lawmakers or doing a day at the Capitol in Michigan, advocating on state level issues. So Just to give you a brief overview of how ACC advocacy is structured, certainly Frank and I represent the state and federal congressional affairs portion of advocacy, but we also do have regulatory affairs as well as payer and care delivery policy. So all of these components are working together in conjunction with one another to make sure that we are doing everything that we can for you all and your patients to make sure that it is an environment that you are easy to work in and able to deliver care to the patients who need it. So I am going to go ahead and share my screen, and I'm going to walk you through what congressional affairs at ACC looks like, and dive into some of the engagement opportunities and cover HeartPAC. All right. So starting off, congressional affairs, what exactly does that mean? That means that we are working with Congress to help shape what federal policy looks like. We're working with the Health Affairs Committee, which is the governing advocacy body, as well as any other relevant stakeholder groups, that policies may touch on. For example, if there is a policy that focuses on a specific, section within cardiovascular care, we might plug some of the section leadership and work alongside with them, alongside the HAC and any other work groups that are relevant to the policy at hand. We're also working with other medical societies on some of these issues, certainly Medicare payment reimbursement, prior authorization, clinician well-being. That's something that we all share with other medical societies. And so we're working together to do everything we can, pull all of our resources to make sure that we're seeing this legislation advance. So what are ACC advocacy priorities? I'm really excited to share this with you all because this is pretty new branding for us. We have reorganized everything into overarching priorities that will, put issues within each priority to really help you all understand, sort of the narrative that we're using to drive our arguments and our conversations with policymakers, to make it easier to see, what the tenor of DC is looking like at the moment and really understand the pulse of congressional activity. So this is the ACC Advocacy Priorities infographic. You'll see different iterations of this, but this is the more simplified version that just outlines what these buckets are. So first of all, we have champion access to care for all. A lot of the issues that will live in this bucket are going to be focused on, health equity issues or any sort of public health initiative. Supporting clinicians and providing equitable value-based care. This is going to include a lot of the work that our payer and care delivery policy team work on. Foster care transformation and optimization. So here we're looking at a lot of the evolution of digital health. So certainly AI related issues as well as telehealth would fit into this bucket. Bolster the clinician workforce now and for the future. So here we're looking at issues that really impact the clinician pipeline or just the administrative burdens that you see every day that can be relieved with some federal legislation. And then establish sustainable Medicare payment practices. I think that's fairly self-explanatory, but I'll dive a little deeper into all of these, and specifically in the sustainable Medicare payment practices bucket, we are looking at both short-term and long-term relief and reform, certainly because it's going to take a bit of time to get where we need to be. So just going to go through a brief overview of where we are with some of these issues to give you a taste of, what legislation is out there and what we've been working on with this Congress. So at the beginning of this year, Congress did pass the Consolidated Appropriations Act of 2024, which provided some relief to the Medicare payment cut that was proposed in 2023 and enacted in 2024. They waited a little bit of time to actually pass this legislation. So the way that the relief was provided accounted for what the 1.25% they were proposing in all of 2023 would have been if it started on January 1st. What that did was that did preserve over $75 million for cardiovascular clinicians in 2024. And I think that number really emphasizes the importance of, as Dr. Fatal said, being a voice, being on Capitol Hill, speaking with your legislator, because if you're not at the table, you're on the menu. And the more that we can do, certainly we don't want you to have to come to DC, asking for relief year to year. And that's why we are looking toward longer term reform. But I think that really emphasizes the importance of coming to DC to really get to that long-term reform. And certainly this year, we see that 2.8% reduction that's proposed. We're going to be doing everything we can, working with other societies and, continuing conversations with Congress to see what we can do to provide short-term relief this year. But there isn't any legislation at the moment that has been introduced. Congress is in recess still, so we'll see what happens when they come back. Looking at long-term reform, there are a couple of pieces of legislation out there. There's the Strengthening Medicare for Patients and Providers Act, as well as the Provider Reimbursement Stability Act. These two pieces of legislation, I think, are a really great sign that Congress is listening to all of the things that we've been saying to them year to year at legislative conference about a need for long-term reform. So the Strengthening Medicare for Patients and Providers Act would provide an inflationary update. So when you're looking at the reimbursement over the years, while practice expenses have risen about 47%, physician reimbursement has decreased 29% over the last 20 years when accounting for inflation. So it's a really alarming trend. And this is something that would at least, address the issue, the inflationary issue at hand. In addition to that, there is the Provider Reimbursement Stability Act that would expand the budget neutrality threshold from 20 million to 53 million. The one listed here is just a House bill. The Senate did introduce a similar bill recently. It is a little bit different, but again, a great sign that at least we're getting, they're stepping stones to that long-term reform. And these conversations, are at least, making a difference, even if it's a little bit at a time. When we're talking about foster care transformation and optimization, telehealth is certainly something that is a key issue for us. So there are several bills, I'll say, not really sure which one Congress is going to land on. But looking at all of them, we're looking at extending the flexibilities that were available during the pandemic to be permanent. So there's the Preserving Telehealth, Hospital, and Ambulance Access Act, as well as one that's a little bit more focused on cardiac rehabilitation services that was introduced by Dr. Joyce. That is the Sustainable Cardiopulmonary Rehabilitation in the Home Act. So you can see there, we're still seeing co-sponsors increase on that bill, 62 as of today. So we'll see what direction Congress takes telehealth, but it's certainly a hot topic on the Hill at the moment. Prior authorization is another issue that falls under this bucket. We were really excited to see the Improving Seniors Timely Access to Care Act reintroduced. So this received sweeping bipartisan support. Last Congress didn't quite make it across the finish line, but we did have the CMS introduce the rule, which addressed some of the elements in the Improving Seniors Timely Access to Care Act. And so what this legislation would do is to make sure that the elements that CMS implemented would not be easily rolled back. So we're codifying this. Right now I think it was introduced with over 100 co-sponsors, 100 original co-sponsors. So clearly, Congress is still really interested in this issue and wants to see it get across the finish line this year. In addition to that, there's the Gold Card Act, which was introduced by Dr. Burgess, who is retiring this year. This is modeled after Texas law, which would exempt qualifying clinicians who meet prior authorization requirements 90% of the time from those requirements under Medicare Advantage plans for a specific period of time. So again, seeing this legislation introduced is a victory in and of itself. It remains to be seen what happens with the Gold Card Act, particularly with Dr. Burgess's departure at the end of the year. but we'll continue to beat this drum. Looking at clinician workforce, here we're taking a look at workplace violence. There is legislation out there that would implement federal penalties for those who knowingly commit violence or intimidation against healthcare workers. And this would be similar to penalties that are already in place for airline workers. So that certainly, we're still seeing that co-sponsorship list grow, and we'll see what happens with that. And there's also some legislation out there and some interest in clinician workforce. So you'll see here, the Senate Finance Committee, bipartisan Medicare GME work group released a request for information as they're trying to figure out policy proposals that would address some of the healthcare workforce shortages that we're seeing. And then finally, I'll end with our Champion Access to Care for All bucket. Frank talked a lot about the AED work that we're doing in the states. There is some federal legislation out there as well. So there's the Access to AEDs Act, and this would provide education, funding for education, awareness, and training in AEDs in elementary and secondary schools. This has some strong support. I'll also add that there is another bill, the HEARTS Act, which has elements of this bill and also provides cardiomyopathy awareness and education. So ACC is supportive of both. I will say that Senator Schumer is very supportive of the Access to AEDs Act. So it's just kind of a matter, again, of which one is going to make it across the finish line. Peripheral artery disease is also something that falls in this bucket. There is the Amputation Reduction and Compassion Act, which would provide more funding for education and awareness about PAD. However, the lead passed away in April, so we're still part of a PAD coalition group. We're just kind of trying to figure out who might be picking this back up. But I did want to highlight this because this was a key issue at legislative conference last year, and just let you all know it's something we're still keeping an eye on. It's just a little bit on pause at the moment, given the uncertainty with who is going to pick this up in Representative Payne's legacy. So that's a lot of issues that I went through, and I am happy to share the PowerPoint after the fact. But there are certainly ways that you can stay up to date with us on everything advocacy related, week by week. So we are on X, formerly Twitter, and the handle is @cardiology. Here we'll share links to any action alerts, advocacy events, as well as important health policy news. So I'll talk a little bit more about engagement in a minute. But the action alerts are one of the easiest ways to get involved in advocacy. We do them at the federal level and the state level. From time to time, we might even have one set up for regulatory. But we put together a template. All you have to do, enter your ACC information, your contact information. It'll identify exactly which legislators that are within your zip code. Send the appropriate message to those legislators, and you can even add your own message if you'd like. But we make it as simple as possible. Here, all we're trying to do is really increase the impact of our voice and make sure that folks know that, cardiovascular clinicians are paying attention and do care about these issues. We also have ACC Heart Pack Update, which is our monthly educational series. I think a lot of these will be really helpful if you're newer to advocacy. I've listed a few of the ones that we have on heartpack.org, some of our more evergreen pieces. Overview of ACC advocacy is a great one to start with because it really breaks down the different areas, regulatory, payer and care delivery, congressional and state, exactly what they work on, and outlines engagement opportunities as well. And we also have the ACC Advocate, which is our weekly newsletter. You've likely seen it in your inbox, but it's a great way just to get bite-sized snippets of everything that we're doing. So looking at opportunities, Dr. Fatal and Dr. Rao both mentioned legislative conference. I can give you a very brief overview of the agenda in just a second, but there are other opportunities as well to stay involved throughout the year. You can meet with your legislator in district, you can meet with your state lawmakers, you can host a legislator practice visit. So the bottom two photos here you'll see are two visits we had this year with federal lawmakers. We do all the heavy lifting. All you need to do is find us a time that works for you, and we'll connect with the office. We'll provide you with talking points. And it's a really great way to spend a little bit more time with a legislator, because the visits are about an hour, and really walk them through what day-to-day care looks like, and be able to, sort of do a show and tell of how these issues are impacting your ability to care for your patients. You can also become an ACC advocate, and I'm going to go to the next slide to highlight that. We made it really easy. This is an ACC advocate checklist that outlines the different major ways that you can get involved in advocacy. After completing this checklist, you will be recognized at legislative conference as well as in ACC publications. And it's just really helpful if you're looking for, information on how to navigate advocacy at all. Like, this outlines everything for you. All right. Legislative conference, September 29th through October 1st. We'll go through this quickly. Sunday in the morning, that is reserved for committee and section meetings. I will highlight a couple that are open for all, which is the section steering, the women in cardiology, as well as the CV team. So if you're an early career or an FIT, the section steering committee meeting has taken on sort of a new form to really be more inclusive and provide more advocacy 101. So I'd highly recommend, if you're getting in town early, to pop into that session. It's a really good way to see how the sections interact with advocacy, get a little bit of networking in, and have a good foundation going into Monday's educational sessions. Sunday evening, we do have our Legislative Conference Advisor Program meetup. This is a part of registration. Again, if you're newer to advocacy, I'd highly recommend joining. We pair those who are newer to advocacy with veteran conference attendees to have someone outside of their chapter to ask any questions to really learn from them how to make the most of the conference and navigate it, make the most of their experience while they're there. We kick off the conference with our Heart Pack dinner. So this is a signature dinner where we bring in keynote speakers who really understand where we are in the current political environment. So this year we have Mike Allen and Jim Vandehei, who are co-founders of Politico and Axios. And I think importantly, they really understand digital media. And as we're heading into October, really ramping up for a presidential election, they'll be able to provide some really good insights on, what to expect in headlines, how to navigate the different media that you see, and, what we might be facing, with in 2025, what congressional dynamics might look like. So it's definitely not to be missed. And all the information for the contributions to attend that are below, but we'll certainly send some reminder emails. Monday is really focused on, getting you the latest updates on health policy and making sure that you have everything that you need to be able to successfully execute your Hill meetings on Tuesday. So the couple sessions that I'll highlight here are AI presentation. So we are still working on developing this, but the brief preview of this is really getting an understanding of, how Congress is tackling AI. It's certainly an early issue, but we can, connect with some folks and see how cardiology fits into everything as they're looking to put out some guardrails. Advocacy at home, that's the session that Frank alluded to. That's a little bit more focused on the Advocacy 365, learning the nuts and bolts to be able to take everything home and institute all of your knowledge in your day-to-day engagement with the Michigan chapter, as well as just your personal journey with advocacy. The legislative issue briefing, that's really important. That's where we'll go through all of the talking points for this year. We'll have our congressional affairs team on the stage to really dive deeper into that and make sure that you have everything that you need to know. And then team-based care on Capitol Hill, that one's another big one where we will have folks at different career stages and in different roles on the cardiovascular care team join the stage to walk through how they would approach the talking points from their own perspectives. Because I think it's important to understand, it's all about telling a story, and understanding how someone in a different role on the team crafts their story can be really helpful. And then Monday, it's pretty easy open afternoon, but we provide some time for a health policy open house where we have tables for each of the overarching theme talking points. So here you'll see 3 of the ones that I went over: establishing sustainable Medicare payment practices, fostering care transformation and optimization, and championing access to care for all. So we'll have staff there after the legislative issue briefing. If you still have some questions, you just, want to get more clarification on, or you want to dive deeper into the issue, staff will be able to help you with anything that you need. We'll also have a table for state government affairs, value-based care, health equity, and we have a patient advocate joining us to share her story, and she will have a table for herself. We'll also have advocacy associates there to answer any logistical questions about your congressional appointments. And then Tuesday, go to the Hill, walk through the talking points, and have a great day connecting with your colleagues in a new way. So I know we're over time, but I would be remiss if I did not, just plug HeartPack. I talked about it a little bit. HeartPack really is ACC's cardiology party. It's what we use to invest in congressional champions. So HeartPack is separate from ACC member dues. We take voluntary contributions, and we are we can only accept up to $5,000. So every little bit helps per FEC regulations. But what we do is we use this to make sure that we have members in Congress who really understand cardiovascular care. We are losing a lot of institutional knowledge this year with a few physician retirements. So it's going to be really important that we're able to connect with folks and spend time educating them about these issues. So we're nonpartisan, it's member-led. I will say, when I say we're nonpartisan, we have an even 50-50 split between Republicans and Democrats, both in terms of the number of members we contribute to, as well as the amount we contribute. So we work really hard to make sure that cardiology is represented well on the Hill. It's certainly an important component, and we'd love to have you join as a member. So that's all I've got. Thank you so much for having me.
Chanel, could I say something real fast?
Yeah.
So first thing I'm going to say is the ACC has the best advocacy people ever. And hopefully you guys come to the conference and see them in action, because it's tremendous in terms of what they do. It's absolutely tremendous. They track everything. They give us the information we need. They help you facilitate all those things that are going to help. Advocacy is kind of like, I was going to say riding a wave on a surfboard, but it's probably even more like trying to create a wave and then forcing people to ride on it. You want to gain some information and momentum for people to understand why they should move in a certain direction. And by people, I mean legislators. I want to say a quick word about the HeartPack, because it always makes me a little upset, even though we have made strong advances in terms of who has contributed to the HeartPack. We are still woefully inadequate, as are most physicians. And I think part of it might be not understanding what it's all about. A part of it might be an uncomfortable sensation about what it means. But recognize. Oh yeah, thank you. That was a great segue. That was a great segue. So we are kind of on the lower end of that list.
This is just the top 10, just to be clear.
Okay, well, so good. So we're moving up. It used to be a lot worse, so this is actually a lot better than it was. If you look at trial attorneys, they pretty much 100% of them contribute to their political action committee. Now, understand why it is important. Regardless of your political leanings and whether you like somebody or don't like somebody, it is our goal to try to get support for the bills that matter for our delivery of care to our patients. So that is the whole goal, is to be able to get access to the legislators, talk to them, make them understand why it's important, and then get the bill passed. So it is different from what you think, or what a lot of people think. And I think the more we can stimulate the growth or participation in the HeartPack, the better, because it's not the amount. They won't look at necessarily how much money you're raising. They're saying what percentage of your people are contributing to this and are supporting it, because the message is a lot stronger if that number is a lot higher. So that HeartPack thing is really important, and it's grown because of the work that all these guys have done. But I cannot overestimate that. That's really important. And I was going to say the other thing is that if and when you come to the legislative conference, you will be provided a lot of good tools. They have an app that is tremendous, that allows you to kind of look at the issues, have it on your phone. I would ask Meg one little favor. The app last year was not as good as the app the year before, because when you pulled up your legislator in years before, it would easily tell you whether they've already co-sponsored a bill, and they didn't do it last year. But anyway, the app is wonderful because you can pull up who you're going to see. It gives them a little overview. It tells them, again, that reminds you of what the issues are. So they do a fantastic job. So that's all I want to say.
Sorry, I thought I was on mute. Sorry. Thank you so much. That was a lot of information, but hopefully everybody soaked in and understood the process and how the policy changes can be made. And if you want to do it, you have to participate. And it's important to make sure that you have a part in it. I would like to now open up for questions from the audience. I know we have about 13 to 14 participants. If you want to raise your hand, if you have any questions, we can take questions.
So Sunil, while we wait for a question, oh, there is a question, so let's take that.
Yeah.
Hi, thanks for this excellent webinar. My name's Ben Fried. I'm actually from the Illinois chapter. And one of the things I'm very interested, or our chapter's interested in, is doing more with our local government in Springfield. We really haven't done much, and congrats to Michigan chapter for doing as much as they've done. I guess the question either is for Frank or Meg in terms of how best to get the ideas that we have actually into action, and does it involve a lobbyist? And if so, are there chapters who have their own lobbyists? How is that process? Just from a logistical
a lot of it depends on the state and just the different aspects of how that works. But what we can do is, so there's 4 of us on the state team, and we have and so we're all assigned different states. So we'll connect you with the our co-worker, so our boss actually, who's in the liaison for Illinois, and he can talk about what's going on there and maybe strategize with you about what a good way to approach it is. We only have a handful of states that have contract lobbyists. Some of them do. Michigan has one; they're very good. Texas, a couple others. But so it's always very helpful. But it's a decision that each chapter has to kind of look at, just because based on it, as you can imagine, a variety of things. But we'll hook you up with Mike Lawrence, who I believe is it Mike. I think Mike's the liaison for Illinois.
I think, Frank, we have a meeting upcoming with Michael Lawrence.
Oh,
so
good.
We'll talk to him a little bit more about it. I was just curious, what chapters were doing it, how many were doing it. I realized a lot of it's based on what the resources are of that chapter, but it seems to me that it's probably one of the best ways to get ideas into action. So
Absolutely. So we'll make that connection for you.
Thanks.
All right.
So, Sunil, if I may make a couple of important comments, great, great overview. Thanks to Meg and Frank and you and Peter for this overview. I do want to mention that there are a couple of important things to look out for. Our chapter executives put out a very nice newsletter with periodic alerts and links for you to actually send these letters, which are already pre-made, as Meg mentioned, to the ACC, where you can just input your email and information, and the letter is already done, and you're welcome to add things. So it just requires 2 minutes of our time. I know I saw 1,100 messages, but for the size that we are as cardiology, we should be having, and the issues that we are facing, there should be much more than that. So please take the time to do it. The other thing is the Michigan chapter has FIT grants for the legislative conference. And so obviously, if you are interested in learning advocacy, and as Peter mentioned, make it to this conference, even at least once to get the feel of it. You're going to see the passion involved in that. So reach out to this chapter. Both the CV team members have grants, which we can, with money assigned, where we can sponsor people for a certain amount of money to go to the legislative conference. And it's a great opportunity for CV team and the FIT members to kind of use that. And the other important thing is keep track of the stories and the challenges that we face. And these are very important because the legislators are really want to listen to the patient challenges that we have. So nothing comes as a true life story of where we are facing these challenges. I have a ton of them within the just last week of just prior authorization denials for key procedures, which are so frustrating to our team. And I'm really thinking hard about holding an advocacy day, as Meg was suggesting, where we can have these people come and see how our authorization teams are just struggling with these people for both medications as well as procedure approvals. So a lot to learn and kind of a lot to do from this angle. So we hope we see more enthusiasm along these lines. And remember that Michigan has actually won the March Madness, the hot pack contributions. And so we are actually leading the pack. So, so congrats to all of you who have contributed, and we look for more contributions.
I'll just also say that at Legislative Conference, Michigan might have a great photo op recognizing you all as the March Mayhem champion. So if you want to be part of that, you should join.
Absolutely.
Any other questions that I can see here? I don't see anyone. We're keeping on time, but I hope this gives an overview and also for a pitch for our Michigan ACC conference coming up September 21st and 22nd in Traverse City, Michigan. And I see many members here who are going to be giving talks. And we also have advocacy update, networking, and FITs. So we want to develop more interest and energize everybody to come to this conference. Of course, the Traverse City conference, but more so for the legislative conference. This is my 7th year of doing it. I do it every year. I block that date. I know it takes time and effort to do it, but every time I come back energized to do more at the local level. So thank you, everyone. And thanks, Meg and Frank, and of course, Peter, for guiding us so far and making sure that this continues on. Thank you and have a good evening.